other elder justice programs across the country. So I'm always, really excited to be a part of these programs. So we wanted to start out by sharing some of what we'll be discussing today. To start with, we're going to be looking at how we identify community partners for outreach to support LGBTQ plus communities, explore ways that encourage LGBTQ plus people to share information about their sexual orientation and gender identity that may be important to their case, and also identify resources to support E-MDT professionals and LGBTQ plus older adults. To start with, we always like to just think about, what does the population of LGBTQ plus older adults look like? Estimates in 2015 indicated around 3 million older adults identified as LGBTQ plus. It's important that we always say identified. We oftentimes, view these numbers as an underestimate because there are many LGBTQ plus older adults that still do not feel comfortable to be out, to identify as, LGBTQ plus. And so we want to make sure that we recognize that this is oftentimes an underestimate. By 2030, it's estimated that upwards of 7 million people will identify as LGBTQ plus over the age of 55. And, we oftentimes say that just as the baby boom generation is growing, so is the segment of baby boomers and now Gen Xers who identify as LGBTQ plus. And so this makes up, the estimated 7 million people by 2030 who will be living in communities large and small across the country. Another misnomer is that all LGBTQ plus people leave their small rural communities where they grew up and move to big cities like New York and San Francisco and Chicago. We're still in small communities across the country. As I like to say, we're everywhere. So if you're doing outreach in rural America, more than likely you're also touching the lives of LGBTQ plus people, their family members and caregivers. So it's important to recognize that we're in all, areas of the country. One of the things we oftentimes hear over the years in the work that we do with community partners is, we've participated in training, we've, done everything we can do to really increase our own LGBTQ plus cultural competency. But now what? What are the next steps? And part of the next steps are really thinking about, putting our lessons learned into action. How do we provide outreach and support to LGBTQ plus community members? And so that's really what I want to talk about for the next few minutes. It's important that we are developing relationships, with all the service providers in our aging network and letting them know that, our programs and services are inclusive of LGBTQ plus elders and, asking them, do you know of LGBTQ plus community members that we can be in touch with at the community level? And that's really how we start to build what we refer to as an LGBTQ plus friendly aging network. It's through developing these community relationships. When we develop the community relationships, then we start to build trust with our LGBTQ plus elders and community members. So we just want to keep that in mind as we think about community partnerships. One of the newest programs at SAGE is a program called SAGE CoLab. This is a program that is designed to develop relationships with LGBTQ plus organizations and social groups, providing services to LGBTQ plus older adults across the country. We now have upwards of 80 LGBTQ plus SAGE CoLab partners in 37 states, Puerto Rico, and DC. And So if you're in any of the states that you see in blue, here on the screen, then you have a SAGE collab partner in your state. And those SAGE collab partners are going to be critical in helping to develop the type of relationships to really do outreach and work with the LGBTQ plus community at the local level. Another partner group that I want to talk about is a program called Centerlink. Centerlink is the membership organization of LGBTQ plus community centers across the country. And Centerlink has over 375 member organizations across the country. You can go to their website and also do a search by region or state, and it will pull up all of the LGBTQ plus community centers in your area. One of the newest partnerships that we've established is, and you all are getting an early look at this partnership. We just established a partnership with Centerlink, and that partnership is called Sage Link. And so we'll be working with Centerlink and their network of community centers to help them implement programs and services that are supportive of LGBTQ plus elders. We'll be providing a series of workshops for the centers, and also some of the resources that we've developed through the National Resource Center will be shared in their learning hub, so that more of our LGBTQ plus community centers across the country are really starting to think about how they can support LGBTQ plus elders at the community level. And so that's another program that we're really excited about. We officially announced that kickoff in October at the Centerlink conference in Chicago, Illinois. So we're excited to see how this program continues to grow the supports for LGBTQ plus older adults across the country. And I briefly mentioned, what we're referring to as an LGBTQ age-friendly or LGBTQ-friendly aging network. And, this work is one of the next things that we're doing through the National Resource Center. For years, we've been working with, community organizations across the country. Many of them have, taken the time and investment in staff training to make sure that their staff and employees and volunteers are LGBTQ plus culturally competent. And they come back to me oftentimes at the National Resource Center and say, we've done the training, we've done the work. Now, how do we find LGBTQ plus people? Where are they at? And, a key to that is building these relationships and helping communities on the ground think through, who are the resources in your local community? Who are the organizations in your local community that you can work with? I work at a national level. I don't always know where LGBTQ plus people are in Timbuktu. So it's important that we're developing these relationships at the community level. And so this is actually a pilot program through the National Resource Center. And this year we started this program with the Alzheimer's Association in 5 states. That includes Florida, Indiana, Missouri, Colorado, and Texas. And so they've really helped us to envision what this work will look like and can look like. Over the next year, we're going to be opening up this work to other community organizations that want to be a part of building their own LGBTQ plus friendly aging network. One of the first things we encourage people to do is what we have here on the screen, which is called community mapping, and start to list, organizations that you want to work with or that you already work with that are LGBTQ plus welcoming, or you think they would be LGBTQ plus welcoming. And having community organizations, come together in support of LGBTQ plus aging. So some of the organizations that we've identified include LGBTQ plus services. Is there an LGBTQ plus community center? Is there a SAGE collab partner? Is there another LGBTQ plus service organization at the local level that you would want to connect with? Start to build that network. Then we also want folks to look at disability services. You know, we need to be thinking about the intersections that LGBTQ plus people hold. Many of our folks, you know, we know that data has shown that we're at higher risk for some disability and chronic illnesses as we age. So it's important to think about disability services and invite them into this work. Aging services, area agencies on aging, ombudsman programs, senior centers. Who are those programs that we would want to be a part of this work? Faith-based organizations. This is another area that oftentimes gets overlooked, but we know there are many LGBTQ plus affirming faith-based organizations across the country, and they can also be key partners in this work. We just connected with a large group called the Open and Affirming Coalition, which is part of the United Church of Christ. And don't quote me on this, but I believe they have over 1,000 partners across the country that they work with through their affiliated churches that are LGBTQ plus welcoming. And, you know, it's groups like that, metropolitan community churches, which are largely LGBTQ plus and allied churches across the country. There's Episcopalian churches, Methodist churches. Those are all good groups to connect with. And we know that many of our LGBTQ plus elders also start to return home to their faith-based communities as they age, you know, from a sense of, you know, reconciling possibly with our own faith traditions and, you know, end of life. That can be really important for folks. So when we think about, you know, supporting our older adults, those faith-based communities can be an important connector at that level. And there may be other types of organizations that we've not talked about here today. You know, we encourage folks to really think about if you're providing services to an LGBTQ plus older adult, once they share their story, and you start to think about the services and supports that they may need from your team, then you start to look at your community map. Do we have the needed services, you know, as a part of our network? And if not, where can we find those folks? You know, maybe it's elder care attorneys, financial planners, law enforcement, you know, adult protective services. Those are all groups that we would want to also look at and encourage them to become a part of what we're calling an LGBTQ plus friendly aging network. So just wanted to share a little bit, you know, about this new model that we're developing here at SAGE. And, you know, always happy to talk with folks if you're interested in seeing how you could implement this model in your local community and the work that you're doing. So one of the other big questions that oftentimes comes up, especially over the last year in work that we've been doing to encourage more organizations to start to collect sexual orientation and gender identity data during intake and assessments. One of the big questions we receive is how do we encourage disclosure of information that's important to the person's case, such as the person's sexual orientation or gender identity? It's important that we take a step back from this question and think about why a person may not disclose. For many LGBTQ plus older adults, this may be the first time they've been asked questions related to their sexual orientation and gender identity. They may feel uncomfortable to answer because they may not know if they're safe. If I disclose this information, could it somehow come back and be used against me? And, you know, for many of our older adults, they've experienced a lifetime of discrimination and stigma. And so it may be a challenge for them, you know, to be ready to openly share this information. And so what I encourage folks, especially when, we're maybe working from a place of crisis, is that information what's most important right now? Maybe we need to take time to really hear the person's story, to start to develop trust with that person before we start asking some of these questions that may seem very personal to them. And once that relationship is established and they know that we're here to support them, then we can go back and ask some of those questions. I oftentimes say it's not just demographic questions related to sexual orientation and gender identity. It's all demographic questions. When we start asking questions about income level and, race and ethnicity, relationship status, all of those things can be questions that sometimes evoke that response of, why do you need to know that? That's my information. That's not your information. So take a step back. It's not our place to encourage people to come out. It's our place to make sure that we're providing folks with the opportunity to share when they feel comfortable. So that's, some of the recommendations that I give. Wait until we develop the trust, then ask the questions. And on the next slide, we're going to talk a little bit more about this. So, thinking, does the caller feel safe to disclose personal information? It takes time. And recognizing, again, the history of discrimination and stigma that many LGBTQ plus people have experienced can just add to that nervousness about disclosing. What signals might be sent to ensure this is a safe space to disclose personal information? One of the things is making sure that we've done our work, that we feel comfortable asking the questions. For many people asking intake questions and assessments, it may be the first time they've also asked about sexual orientation and gender identity. If the person asking the questions is nervous, then that's going to make the person being asked the questions not feel comfortable. There's training available around how to ask inclusive demographic questions. If you've not taken part in trainings such as that, I highly encourage you to do that. That can go a long way to really building up your own cultural competence when you're asking these types of questions. Another thing that LGBTQ plus people have, over the years really paid attention to is non-discrimination statements. Does your organization have a non-discrimination statement that's inclusive of sexual orientation and gender identity? That's something we oftentimes look for. That's our first signal to really share that this may be a safe place. They recognize our sexual orientation and gender identity within the non-discrimination statement. So I feel more comfortable to disclose should I be asked. What other signals might someone be looking for? It can be pictures on the wall, looking at your website. Are there, do people see themselves reflected in pictures that are used on the website? If they're only seeing heterosexual couples or couples that we may presume to be heterosexual, then they may not feel that they're represented, on your website and on your brochures and other forms. Is the personal information needed immediately? Again, when are we asking demographic questions? Are we asking them right up front at a time of crisis when a person may not even know what information is really important to share at this time? Or are we asking the questions later on as we've developed rapport with that person? Is this something that we can go back to in a follow-up phone call? Or do we need it right at the moment? So those are things that we really want folks to think about as they're working with LGBTQ plus older adults. It's also important that we understand, the perspective of the LGBTQ plus person. And there was a study done in 2023. There's a link to that study at the bottom of this slide. And, they ask the question, what helps to ensure LGBTQ plus people feel safe? They want to be seen for their authentic selves. We want to know that when we are reaching out for support, that people really do see us for who we are, and that they really do want to support us for who we are. Being seen, not having, and I'm not really sure, this is a bad statement that I have here. I'm not sure what I meant, and it doesn't make sense to me. So being our authentic selves, being seen for all of our identities. We have intersecting identities, race, economic status, ability level. There's so much more to us than just our sexual orientation and gender identity. So really being able to see all of the intersecting identities that we bring to the table is really important as we're working with LGBTQ plus folks.
Sherrill, I think you probably meant not having to hide LGBT identities.
You're probably right, Lisa. Thank you for that. It's always good to have supporters in the room. So I believe you're probably right. So thank you for that. But again, this is, I would encourage you all to look at this study for more information around, how people want to be seen and what it means to feel welcomed and supported in our social environments. I now want to share, spend some time just sharing about some of the resources that we have available at SAGE. And, as I mentioned in the beginning, one of the programs that I lead at SAGE is our National Resource Center on LGBTQ plus aging. And this is, a library of resource guides, toolkits, fact sheets, webinars. We encourage you to visit the Resource Center at lgbtagingcenter.org. And all of our materials are, downloadable. You can download, print, share. If there's something that you want to cross promote on your organization's website, we're happy for you to do that as well. So, please feel free to take a look at the resources there. And I'm going to share just a little bit more about some of the specific resources that may be of interest. One of our first best practice guides that was developed when we first started was a guide called Inclusive Services for LGBTQ plus older adults. And it's the purple guide here that you see on the screen. And it's really about, what can we do as an organization to make sure we have welcoming practices in place? Looking at our non-discrimination statements, what type of pictures and images are being used on our websites and our brochures? Have we, provided LGBTQ plus cultural competency training and awareness building activities? Are we encouraging LGBTQ plus people to serve on our boards and advisory committees and, serving as volunteers? Those are all ways that we can really promote welcoming practices within our organizations. Another guide that we developed is one for strengthening our state and local aging plans. While this was really developed with area agencies on aging and state units in mind, there's a lot of good information in here about goals and outcomes that can be used for strategic plans and other, programs and services that you may be doing at the local level. Another guide is on local advocacy. And this was really designed for the LGBTQ plus community to think about how they can be advocates, steps they can take to engage with local community organizations and be a part of creating that change at the local level. And then another guide that we have available is Inclusive Questions for Older People. And this is around how to ask inclusive questions around sexual orientation and gender identity. So these are just, a few of the resources that we have, and we encourage you to take a look at these resources and others that are available through the National Resource Center. Another program that we have is one called SAGE Hear Me. And this was really designed to help support the mental wellness and health of LGBTQ plus community members. Right now, this program is a 24/7 app-based program. So for folks that text, they can sign up to receive a text from Hear Me. And for a person who may be, home alone and socially isolated that needs support, they can send a text once they're signed up for the program, and a volunteer will be in touch with them. And so again, this is available 24/7. We encourage you to make this available for folks that you may be supporting that may be in need of help from the Hear Me app. Maybe you would like to volunteer to be a part of Hear Me. We are also encouraging folks to sign up to be volunteers, to be one of the people that would text an older adult who's needing support. And so you can use the QR code here or go to the website sageusa.org/hear me to sign up to be a volunteer with this program. And then another program that we have is Sage Care, which is our LGBT cultural competency training. And we provide training to a number of ACL funded programs, APS programs across the country, elder justice programs, ombudsman, area agencies on aging, and a number of different topics, such as supporting LGBTQ plus older adults, asking inclusive intake questions. We have a training specific to supporting transgender older adults, and one on HIV and aging. This is just a sampling of the programs that are there through our Sage Care training program, but we would encourage you to take a look at those as well. And then finally, just want to make sure that you have my contact information. I always encourage folks to reach out if you have questions, concerns, or interested in technical assistance. Then, please feel free to send me an email, and I'll do my best to see what I can do to support you or refer you to another program at Sage that may be able to best support you. And I'm now happy to take questions from our audience that's with us today.
Hi there. It's always hard when you can't see who's talking and things like that. But hello, my name is Catherine, and thank you so much for this informative presentation. I've been lucky that I've gotten a few elder abuse cases from the Los Angeles LGBT Center, and I do participate in whenever I can. The past 2 years, I've participated in the Pride events with Northridge Hospital, trying to get, more awareness, things like that out. But what I've realized is the Los Angeles LGBT Center is like so many other places, is they're short-staffed, and a lot of times they don't have the bandwidth to come to meetings and things like that, because I really want them to be. I'm so excited because I've gotten, I think, 3 cases from them, and that was last year, and I've been trying to approach them this year about how I can get them to join my enhanced multidisciplinary team, but they're just like, we don't have the bandwidth. And I wanted to touch base with you on how can I best approach that situation, because I want to diversify my team as much as possible and things like that. Or if there's other organizations in Los Angeles that you would recommend.
I think that is a great question. And I do agree with you. So many of our LGBTQ plus organizations, oftentimes they're small and under-resourced. And so having, like you said, the bandwidth to sit on an advisory committee can sometimes be challenging. And I would encourage you to think, are there other ways to engage? Is there an older adult that maybe is retired from social services that could be a potential, person to sit on that committee? And looking at other places for allyship, such as faith-based communities, other service organizations that may have, volunteers or staff that may be interested. I think part of it's casting a really wide net and, seeing who may be able to be a part of that. We also find, a lot of interest on college campuses, a lot of young professionals, in social work programs, psychology programs that may also, have an interest in helping to, do some of that research at the local level to help find community members that may be, open to participating in that work.
Thank you. I appreciate that. And you know what? You're so right about faith-based communities and also about just colleges, because I've done quite a lot of work. I used to go to California State University, Northridge, and my hospital is like down the street and we have lots of events with them. So and I do have relationships with the different clubs on campus. So that's a good idea. But I think what's hard is because in terms of the scope of my grant is we're dealing with the really complex cases. And I'm like, I need someone with more expertise. And I think that's, all of us, that's been the hardest part, but I really appreciate this. And it's so important. It's such important to have these types of resources. So thank you.
Yeah. And that's, Catherine, I wonder, would it be possible for, someone who is retired, who still wants to give back, that's worked in social services or potentially within some of the work that you all are doing that, might be a good resource.
Very true. And especially because there's a lot of people who are in this type of world that want to give back after they retire.
Right.
So I'll look into that.
Yeah.
Thank you.
Any other questions for Sherrill or comments?
Lisa, you're on mute.
Yeah. One of the things that I appreciated your kind of, windshield survey of look around your agency and see what cues might be there. What do we do when the agencies that these coordinators work with think that they are LGBTQ plus friendly and welcoming, but there are no LGBTQ folks coming in their doors or asking for services. So there's a disconnect at some way. How can the coordinators who aren't part of those agencies, start that conversation in a way that wouldn't be putting them on the defensive?
That's a good question. We oftentimes say that a lot of some organizations, when they say, well, we don't serve LGBTQ plus older adults, or we've never had an LGBTQ plus client, more than likely we have.
Right.
Again, it's just folks haven't maybe felt comfortable to come out and maybe haven't felt safe to come out. And so I think it's constant work that we have to do to create those spaces where people really do feel safe. And again, I think, how are we doing outreach and where are we doing outreach? Anytime you're doing community outreach, speaking to a local organization, service club, professional network, you are also speaking to LGBTQ plus people, whether they're out or not. And, so I oftentimes tell people if you're doing outreach at a church, have a brochure that has some symbolism that the LGBTQ plus community is going to recognize, whether it's, a rainbow or a non-discrimination statement, something that says, oh, they see me, they recognize me. If you're going to a farmer's market, there's going to be LGBTQ plus people there. Make sure that your outreach materials are inclusive. If it's an organization, that's not sure about steps they need to take to be more open and welcoming, the resource guide I shared in the beginning about welcoming practices, it has a checklist that people can, maybe it's a group of coordinators sitting down around the table and saying, okay, let's go through this together. Do we have these things in place? If not, is it something that we can, work with our leadership to put in place? And sometimes it may be one individual, that really has embraced LGBTQ plus inclusive and welcoming practices. And so how does that person, show that they're welcoming? And, that may be through, again, just how they talk and welcome people into their circles. It can be challenging. Oh.
Thank you.
Thank you, Lisa. I've gotten more comfortable with silence to allow people time to ask questions, but I also don't want to belabor, the moment. So, happy to continue to answer questions, or we can start to wrap up.
Thank you, Sherrill. I did put into the chat a link for a survey. Please, if you could just give us feedback on today's presentation, that would really help us in our planning for future presentations. And I want to say thank you, Sherrill. Not only did you really give us a lot to think about as far as engaging with LGBTQ community individuals, but also so many resources to check out and see. And I have a feeling that they're going to turn into rabbit holes where there'll be things to click on and we'll go in many different places. So thank you very much for sharing all those resources with us too.
Yeah. And, I'll just share, one last statement, Marty. I think, taking the time to read one of the resource guides to see what things could be implemented at an organization, sometimes that's all it takes to start having these conversations. And so if somebody's from an organization that they don't know if it would be, welcoming or not, share some of these resources with coworkers, start the conversation. Sometimes all it takes is one person starting that conversation to help make change at the organizational level. And if a listener, finds themselves as that one person who they don't know how to start, and, they want to reach out for support, send me an email. I'm always happy to have conversations with folks.
Thank you. And as you see, Sherrill's contact information is on the slide. I will be sending out the slide deck. I'll fix that one word on slide 13.
Yeah, thank you.
Send it out again. Any final comments?
Thank you.
Thank you.
Well, thank you for coming. With that, I will return the rest of your hour to you. Thank you so much for joining us today.
Thank you all.